Hello, my name is Oved Amitay, and I'm the president and CEO of Solve M.E. And today is my real pleasure to welcome Dr. David Hardy on board as our medical advisor. And maybe before we introduce you, David, why do we need this role? I want to make sure that we talk about that as well. ME/CFS has been ignored for many, many years. And although we've had some scientific progress, it was slower than we all wanted. And now with the overlap in presentation with long COVID, where we see so many people who have fatigue, the post-exertional malaise, and the cognitive dysfunction that are so similar to ME/CFS, we feel that there's going to be an explosion of data and a lot more research that's going to get us closer to having therapeutic options and medical interventions. And so we felt that as an organization, to better serve our community, we need to have an advice from an experienced clinician who does have the scientific background, but also the foresight on where we can go towards more therapeutic options and better outcomes for everyone who's suffering from both ME/CFS as well as long COVID. So, Dr. David Hardy, it's a pleasure to welcome you on board. And David, if I may ask you to introduce yourself and your background.
It's my pleasure, Oved. Thank you very much for that very warm and kind welcome. I very much appreciate and feel great about becoming part of ME/CFS because I think this is something that has been a long time in coming. And as Oved said, this is going to become, I think, a situation in which more and more people are going to be affected by post-viral or post-infectious illnesses. I've been trained as a infectious disease specialist, and my primary area of research and patient care has been through HIV. I've been an HIV practitioner and researcher since the early 1980s, and at the same time also an infectious disease treating physician at the same time. So one thing that I've certainly noticed during this period of time has been the discovery and description of post-viral syndromes. But as Oved always also said, they've always been a real enigma to most practicing physicians. And for that reason have oftentimes gotten, I think, a short shrift, a short attention span for many of the individuals who are trying to be put in positions of care providing for persons who have ME/CFS. And therefore that situation never works out very well. I have seen many patients who have come into clinics where I have been working as a clinician, complaining of symptoms of ME/CFS, and it has been difficult to oftentimes put a simple diagnosis even as to what it is, because oftentimes the syndrome was very poorly described in the past. With the advent of an increasing number of reports of long COVID, I think this is going to be something that's really going to change. This is going to be a place where science and medicine and advocacy is all going to have to come together to really make this an effective way for a clear definition or definitions of what ME/CFS and long COVID look like, how they can be identified, diagnosed, and also treated. You know, in order to be able to find really good evidence-based treatments for many medical conditions, there must be at least a hypothesis as to what might be causing it. Looking at that hypothesis, we can then look for or devise new treatments as a way to try to help those persons who are suffering, particularly from the fatigue-causing effects, the mental fog, other sorts of effects that are a big part of this post-viral illness.
So David, you mentioned you started your career treating people with HIV/AIDS, and I remember personally that at the time, I thought that was going to be at the end of the human race. Fortunately, that has not been the case. But could you share a bit more from your perspective from the early days? What do you see the similarities between HIV at the beginning and where we are today with understanding those post-viral diseases? What has been the journey for you personally and for the community of people with HIV?
Well, I believe there have been some very interesting sort of similarities. Very early in my career, I can remember before the cause of AIDS was found, before the virus HIV was identified, there was a lot of questioning as to what caused this new illness. People could identify it as people getting very immunologically ill, and there was a way that they could actually find a diagnostic study, but there was no cause for what actually was making these immunologic deficiencies, even though we could see the results of them. And of course, people complained of many of these illnesses as well. There was also a great fear of persons who had HIV because it became fairly clear that it was a transmissible illness. Can't say viral yet at those times, but turned out to be a virus. The analogies I see with this, with ME/CFS, is the fact that many physicians in the days of early HIV, and even sometimes even now, shy away of taking care of people with this for many prejudicial or inadequate training reasons. Instead of having a compassionate, interested, questioning sort of attitude, saying, let's see if we can find a way to help you feel better, live better, the attitude is, I don't know what it is, I don't care what it is, and get out of my office sort of thing. And that was something that many people with HIV experienced as well. So there are some analogies, particularly on the patient care side, of who's going to step forward and find and deal with this new illness, and who's going to turn their back on it and walk away and say, I don't want to have anything to do with it. So in that way, there is some changes. One thing that really, in that way, there are some similarities that are very important. One thing that also comes to mind is the advocacy that was so very important at being able to gain attention, gain some leverage for generating treatments in HIV. And I think that is something from which the ME/CFS community could learn, because that oftentimes what it takes is getting persons, especially who control research funds, to be able to put their money in those places where it's really needed.
Yeah, and so then when you look back at at your personal journey with this disease and with this community, I mean, at this point, is it fair to say that AIDS has become more of a chronic disease? It's still not preventable, right? But what do you think that there's, from your perspective, looking at that, is there an optimistic view on where we go?
My short answer to that is an overwhelming yes, but there's a lot to that. The one thing that the research into HIV has created has been a huge amount of research about the human immune system, about how to detect viral particles, and in order to better understand how the immune system works, to better understand how sometimes the immune system works too well in terms of causing immunologically mediated problems, and that can in fact damage the body itself. And I think the one thing that many illnesses have already benefited from are the advances in technology that have occurred because of HIV research. It is true that HIV is not curable at this point in time. It is treatable, and the medications that are used to treat it have certainly improved greatly since they were discovered back in the late 1980s. And we do now consider HIV to be a chronic treatable medical condition that many people in the world are living with, millions now. It is preventable, but only by taking a daily pharmaceutical or now monthly injection of antibiotics. There is no vaccine. The tool we've used to prevent most viral illnesses, because it's been very difficult to develop a vaccine against HIV/AIDS. But what I hope can occur here is that the scientific learnings and advances that have occurred because of HIV research can be utilized to look more deeply into the causes of whatever is behind the post-viral illnesses known as ME/CFS and now long COVID. We have wonderful investigational tools in the laboratory and also through clinical research to be able to apply now to other illnesses to help us get better windows into what is the cause and hopefully then the treatments for illnesses like ME/CFS and long COVID.
For that to happen, David, who else needs to be part of this research? What other disciplines, scientific disciplines, or medical specialties do you think should be involved?
Well, I think the number one person that needs to be involved, and this is going to become a common theme for me, is that it's the people who have the illness. The people who have the illness are the best sources of learning that we have to get them involved, to tell us how they're feeling, what occurred before they became ill, and how things are going for them over time, with their progression or non-progression, or when they have stability, what they have tried themselves in terms of trying to get better. That is a wonderful source of information to start with. And I know that ME/CFS has a database, a registry of individuals who have stepped forward to be a part of this, because learning from our patients who have this illness is one of the most important starting points from which we can learn. Beyond that, the infectious disease doctors who oftentimes have taken care of these individuals initially, especially with the advent of long COVID, but also immunologists are going to be involved here, rheumatologists, pulmonologists, doctors who take care of patients who have lung illnesses, cardiologists, heart doctors, and neurologists are all going to be involved, because there are different aspects of these specialty areas that we know are a similar and consistent part of ME, of chronic fatigue syndrome, and also of long COVID. And so a coming together of these different sort of parts of the body specialists to really help understand what are the manifestations, what do they look like, how do they associate, what is the common thread through all of them perhaps. It's going to help create a hypothesis that we can start, or I should say a number of hypotheses that we can start with in order to be able to better understand this illness, to be able to devise treatments and really follow a pathway that will lead to something that can be very beneficial for people who have this.
So for AIDS, it has taken a long time to get to that point. What do you think our field will be 3, maybe 5 years from now? What would you consider to be success during that period?
With an illness like ME/CFS and now long COVID, what has been coming out of the literature most recently about long COVID, I should say, has been really a recapitulation of what has been talked about with ME and CFS in the past, except in greater numbers, much greater numbers, because so many people have been affected by COVID-19. With this has become a renewed interest in describing what the manifestations of this post-viral illness are like, what organ systems they treat, what is their natural history, how they get better, get worse, how they change, and even early now, some interventions that have been tried to try to make them improve the condition. This is right now, what I like to kind of call the wild, wild west, where anything goes. No one knows exactly what causes the illness, and therefore lots of different ideas, maybe hypotheses, are being generated and acted upon, meaning treatments have been utilized that may or may not have much of a scientific basis, or are being borrowed from other areas where perhaps they've worked before in an illness that may or may not be similar. So this is an area where I think scientific methodology needs to be utilized, where we're going to be able to carefully be able to understand, how do you make a diagnosis of ME/CFS and long COVID? What are the manifestations in different parts of the body, the brain, the lungs, the heart, the immune system that permeates all of the parts of the body? To better understand what this diagnosis looks like, how to make it, try to find some sort of central principle or central hypothesis that can explain it in a way that we can then not only help people understand what they have, but also reassure them that we are doing something to be able to through increased understanding scientifically and medically, devise treatments that make sense, that are based upon the science of what their illness is telling us, to help them feel better.
Great. Well, David, I hope that we can be here in 3 or 5 years and look back and see the progress that has been made. And hopefully by that time have not only hypotheses and specific areas to focus on, but really some safe and effective therapies as well, and maybe other ways to intervene. So I welcome you on board. I'm delighted that you're joining the effort to make a difference here, and I really appreciate your time today.
It's my pleasure, Oved. I really look forward to working closer with you and your colleagues and with the whole community. Thank you for the introduction.
Thank you very much.